In February, I had the pleasure of attending the Congress of Future Medical Leaders. I had the wonderful opportunity to meet many inspiring people and share their experiences through their stories. These inspiring people included young inventors, prodigies, researchers, and patients with miraculous stories to tell. I also got to share a room with many inspiring young scholars. I found myself most relating to Jack and Draca. He recounted how his high school biology teacher did not take him seriously, providing little support or encouragement, which he clearly deserved. He did not allow this disappointment to affect his passion for discovery or shake his determination to succeed. He was driven by witnessing a family member suffer from pancreatic cancer. This fueled his journey to develop a new pancreatic diagnostic test that is 28 times faster, much more affordable, and works on lung and ovarian cancer as well. His goal was to create a diagnostic test for pancreatic cancer that would detect cancer at an early enough stage so that treatment would be more effective. Like Jack, I find passion in discovering new therapies and cures for disease. I often find myself looked at by my high school teachers and faculty as though my ambitions would fall short. My inspiration to contribute to the discovery of life-changing medical breakthroughs stem from my experiences in witnessing hardships of not only myself, but those close to me that struggle with rheumatoid arthritis. I experience pain physically and emotionally, and I know the frustration that goes along with it. In addition, I'm well aware of the downfalls and side effects of the currently available treatments. After years of harsh drugs, one of my friends is slowly losing his hair at the age of 20. Another is faced with liver failure at the age of 26. And I have underwent 2 reconstructive knee surgeries as a result of rheumatoid arthritis. This inspired me at a personal level to dig deeper for better alternatives. Rheumatoid arthritis is not a rare disease. Approximately 2.5 million Americans is faced with it, and this is a worldwide problem. Rheumatoid arthritis is an inflammation of the joints due to a dysfunction in the immune system. Physical symptoms include painful, inflamed, and stiffened joints, fatigue, and possible weight loss. The pattern of inflamed and stiffened joints generally is symmetrical. That means if a joint in your left side is aching, typically the right one would be affected as well. Emotional symptoms also come with rheumatoid arthritis. These include depression or low self-esteem as a result of pain and lack of mobility. Rheumatoid arthritis is classified as an autoimmune disease. This is when the body's immune cells launch an attack on auto or self-antigens. An antigen is a protein located on or inside of specific cells for identification. This allows the body to either recognize components as self or foreign. When an antigen is recognized as foreign, the body's adaptive immune system produces specific antibodies against it. These specific antibodies will only attack what they're specified for. When these antibodies bind to something, they tag them, consequently facilitating and processing by phagocytic leukocytes, such as macrophages and neutrophils. Phagocytic leukocytes are cells that have the ability to bind and digest antibody-antigen complexes. Rheumatoid arthritis initially has the antibody immunoglobulin M, IgM. Initially, IgM recognizes auto or self-antigens as foreign, binds to it, and tags it for destruction by phagocytic cells. IgM is known as an early antibody response because when IgM is initially exposed, it reacts, but then in response, it sends a message for IgG, immunoglobulin G, to be produced. IgG then takes over in an effort to eliminate the foreign agent. The production of IgG targeting these autoantigens results in ongoing autoimmunity. Because these antigens are located all over the body and it's impossible to eliminate all of them, the result is ongoing in the development of RA, rheumatoid arthritis. Symptoms develop during the IgG generation, not during the IgM generation. The difference between IgM and IgG, besides IgM is an early antibody response, is IgM is a pentamer structure. This means it can bind to 5 antigens. IgG is a monomer structure. That means it can bind to only 1 antigen. The goals of current treatment include reducing inflammation, preventing damage to bone and connective tissue, preserving movement, and helping patients improve their quality of life. There are 4 classifications for current treatments. These include corticosteroids, non-steroidal anti-inflammatory drugs, disease-modifying anti-rheumatic drugs, and biological response modifiers. Corticosteroids and non-steroidal anti-inflammatory drugs control inflammation and pain. However, they do not affect the course of the disease, so the destruction of tissues still happens. A commonly known example of a corticosteroid is prednisone. A common side effect of prednisone is elevated blood glucose level. This can worsen or even contribute to the development of diabetes. A commonly known example of non-steroidal anti-inflammatory drugs is celecoxib, which is also known as Celebrex. Disease-modifying anti-rheumatic drugs slows the progression of rheumatoid arthritis. However, side effects are very harsh. The most common side effects with this type of drug is liver irritation or kidney failure. A commonly known disease-modifying anti-rheumatic drug is methotrexate. This is actually a chemotherapeutic drug. However, it's used in lower dosage to treat rheumatoid arthritis. Biological response modifiers block immune factors causing tissue damage. An example of this is etanercept, which is known as Enbrel. This increases the risk of infection. Some people even have to alter their lifestyles to make sure they do not get an infection. My approach directly targets and neutralizes the auto-antibody IgG. I would like to target this by producing an engineered protein that mimics the folding and orientation of the autoantigens that is specific for binding to the IgG. IgG would be neutralized, preventing it from binding to and tagging the autoantigens on the surface of cartilage cells for immune destruction. By neutralizing at the IgG tagging stage, leukocytes would be destroying the modified protein instead of cells. Because this would prevent the IgG from binding to autoantigens, triggering the immune response that causes tissue damage, inflammation would be reduced, movement would be preserved, and because there is a specific component of the immune system as a target, side effects would be more limited in comparison to the drug suppressing the immune system as a whole. There are, however, downfalls to this approach. Not all destruction of autoantigens would be stopped because there are multiple components to the immune system. B and T lymphocytes are also found elevated in rheumatoid arthritis. All people have a small percentage of these autoreactive B and T lymphocytes. That means everybody has B and T lymphocytes or B and T cells that will attack self cells. These are normally regulated by T regulatory cells. For an unknown reason, and multiple factors play into the disruption of this regulation. So why target IgG instead of B lymphocytes or T lymphocytes? Well, IgM and IgG are used for the rheumatoid factor in blood tests to detect for rheumatoid arthritis. IgG is a known cause of rheumatoid arthritis. In 80% of patients, this is elevated. By stopping the IgG stage, it would be tagging the modified protein and stopping the destruction that is caused from this drug that we know is crucial, or this antibody that we know is crucial to this disease. Throughout the Congress that I attended in February, my passion and determination grew more than I could have ever expected. I always knew I wanted to be a physician. However, it's through my work on the essay that went along with this and researching the new possible therapeutic approaches for rheumatoid arthritis treatment that inspired me to specialize in immunology in the future. The prodigies I got the opportunity to meet and the knowledge I have obtained through this entire process has encouraged me to push forward and has reassured me that no matter your age, your background, or your support system, anything is possible. And the Congress of Future Medical Leaders has ignited a passion in me for the world of medicine. Thank you for that opportunity.